Cancer program goals are addressed in Standard 1.5. Each calendar year, the Cancer Committee must develop, implement, monitor, evaluate, and document at least one clinical and one programmatic goal. Each goal is evaluated at least twice each year. The process is one method to evaluate the program itself. The goals can come from any discipline within the Cancer Committee. Goal setting is important to all cancer programs. Goals help set the direction for the program. Clinical cancer program goals will focus on the care of the patients, such as diagnosis, treatment, or the provision of a new service. The programmatic goal is set with the scope of the program in mind, the coordination of a process, such as one aspect of patient navigation, or certifying oncology nurses as providers for the ONS chemotherapy and biotherapy course are examples. Goals are not a restatement of a COC standard. It's expected that programs will comply with each of those. Cancer committees meet the standard by establishing at least 2 goals and a time frame for achieving the goals through the year. The monitoring and evaluation must take place at least twice per year and documented in Cancer Committee minutes. A program goal that is not met can be carried over to the next year, but there must be a new and different set of goals for the following year. A coordinator should be assigned to monitor the process. Planning the goals is essential in order to allow time for the required monitoring and twice-yearly evaluations. A compliance rating is applied for this standard when there is at least one clinical and one programmatic goal established by Cancer Committee, and the program can show that they have been monitored and evaluated at least twice yearly with documentation provided. A compliance rating would apply if a goal is completed by the first evaluation. A second evaluation would not be necessary. Documentation for this standard includes completing the SAR and providing a surveyor with Cancer Committee minutes or other documents tracking the activities and timelines involved in meeting the standard. The use of the SMART specific, measurable, achievable, realistic, and timely goal-setting tool is a best practice for cancer programs. Discussions at Cancer Committee meetings should take place throughout the year for the purpose of identifying the next clinical and programmatic goals. This practice could facilitate the goals being established at the first Cancer Committee meeting of the year and allow for monitoring and evaluating the goals in the second and third quarters. Thank you for viewing this video on the COC standards, and remember to view the remaining videos in this series to further increase your knowledge on the standards. For additional resources, be sure to visit the COC website at www.facs.org/cancer to access the COC Educational Portal, Best Practices Repository, and Cancer Forum.